Definitely on. Okay. Good morning, everybody. Thank you for taking the time to spend some time with us today. Obviously, we have the opportunity to actually share some insights as we go into the lunch hour just prior to the panel discussion. So maybe just to start off, a couple things just from maybe a human factors. And this isn't going to be human factors or a human insight psychology presentation, but I thought it might be interesting just to share. It's actually said that based on information that is shared in a presentation, that individuals will only retain probably about 50% of what any speaker will actually say roughly 30 minutes after they actually finish the presentation. And then actually that 50% drops another 10 to 40% actually a day later. So essentially, no matter what Bonnie and I say today, you're not going to remember anything. But hopefully what we do understand is, and this actually just goes in with human connections, is actually most people don't remember what you say. They do remember how you made them feel. So ideally, we actually share something that maybe sparks some type of feeling that is either maybe potentially amusement, concern, risk, hopefully not boredom over the next 20 minutes, but at the worst case scenario, if it is boredom, it's only 20 minutes of your life, at least entertain us for the next 20 minutes. So as we heard earlier, I'm Mike Bond. I actually lead the Labstat organization. Jason did a great job of introducing the organization. We are a global contract research organization. We're located in the US, Canada, and overseas in Europe. We work with all types of organizations, primarily in the tobacco nicotine space, but actually have ventured into the cannabis, CBD, hemp, and also dietary supplement. And to my left here is Bonnie. I'll let Bonnie introduce herself as well.
Hi, everyone. Bonnie Coffa. As mentioned earlier, I'm a consultant. I split my time between Chemular and Labstat. Background is toxicology, and I've been in nicotine tobacco testing for about 10 years.
Okay, so let me just grab the pointer or the clicker here. That will help us move this along. Okay, so here we're talking today really about the importance around selecting your strategic vendor partner. So what can happen if you don't? So over the last, let's take maybe a 10,000 step up. We've heard a little bit from this morning, but from Chris, Stacey, obviously, and Lillian as well too, just around the market and the landscape that we're in. So almost 3.5 years later, it's now, it's been since. Oops, sorry, I'm clicking here forward. Go back here. Since September of 2020, obviously, when the first PMTA submissions took place, we've seen a lot of challenges over the last number of years. As we take a look at that particular segment, what we've really seen, obviously in our space, is really 4 types of different client segments that actually have emerged. Those organizations who put together a very substantial PMTA. Chris was talking a little bit about them this morning, and perhaps they've received their marketing approval orders as we speak. Those organizations who put together a very light PMTA application. We'll touch on what has happened with those particular organizations in the slides to come. And some organizations who went through the process of really taking a look at their supplier community and potentially making the mistake of selecting the wrong suppliers as they went through that actual application process. And we'll touch a little bit on at the end of the presentation if those organizations who have made those types of choices, the kind of opportunities that they have to potentially look at for future. If we just now think about the actual PMTA, so where we are. So in September of 2020, you've probably seen the data before. More than 26 million applications were submitted at the time. Just a huge bulk of information that came across the FDA. At this stage, almost 99+% of the actual applications have been rejected in some way. Stacey was talking about this earlier, just in the presentation previous. And really just, at this stage, only 23 marketing authorizations. So for the amount of volume of work that has taken place over the number of years, very, very little reward is what we would all probably agree in the room today. I don't, Bonnie, anything else to add just on the kind of the landscape of the PMTA?
No, I think you hit on it. Just very dim, right? Just barely 1%.
Absolutely.
Yeah.
Maybe you could actually just walk the group through just this FDA rejection and some of the information just here available for them.
Yeah, so a couple of the earlier speakers have already hit on the variety of different reasons that FDA can reject your application, whether at the acceptance phase, filing phase, or substance review. So you need to generate good science, right? Don't give them a reason to just reject your application. And as mentioned earlier, with the substantial equivalence pathway, that's the complete opposite of what we're seeing for the PMTA pathway. It's definitely more straightforward. Companies understand what needs to be done, but the bar is different, right? You're looking at no different question of public health for substantial equivalence application as opposed to a PMTA, which is appropriate for the protection of public health. So the science that needs to be generated is definitely a lot more. But in this regulatory environment, you need to be really strategic about the science that you are generating. And we know that people have spent millions of dollars to get zero returns on them. So I think we'll elaborate more on what is strategic testing, but you can't just pick any lab, right? So you can't just check the box and pick a lab. You really need to be careful on the lab that you select.
So complexity in the marketplace as we speak. I thought it'd be also maybe just interesting to share a few tidbits. So what did we see in 2023? So no question, some of the things that actually started taking place in 2023 is FDA started their enforcement. So one of the things that they certainly committed to do over the coming period is to accelerate that activation of enforcement across. So we're starting to see violation letters going out to particular organizations. We've also seen the FDA partner with Border Control and the Justice Group as well too, as they think about putting injunctions in place with bricks and mortar e-com organizations who are obviously moving e-cigarettes across the US marketplace. So clearly this kind of trend that we're seeing in 23 from the FDA, based on the information that has been shared many times in a lot of public forums, will continue only to increase and therefore adds more complexity in the compliance landscape. In addition to that, though, we also saw in 23 some interesting activities from the actual big majors as well, too. So we actually saw Enjoy, obviously an organization part of Altria, actually file for a number of litigations against both domestic and international manufacturers, which isn't a big surprise. We've also seen some of this activity from Reynolds in some of the petitions that they put forward. So does this continue, this kind of type of activity continue? It's not a guarantee, but certainly of those organizations who actually have their marketing authorization, there's no question, I'm sure they are looking at ways in order to accelerate the investments that they've made to go through those approvals. So that obviously presents additional complexity, challenge, and risk for manufacturers, they think not only at the regulation side, but also from the litigation side that was talked to a little bit earlier today. So what does this mean, and why do we share this? Well, turbulent times, difficult challenges to manage and navigate, and certainly as you think about your product and your product manufacturing, and if you're an organization that in the long run is looking to actually work in a legal framework and therefore is interested in going through a PMTA application, the critical decisions that you make in order to actually select those correct vendor partners in order to actually help solve your problems across this actual long and arduous process is highly critical. So Bonnie and I have put together what we think are kind of the top 10 things you should be thinking about as far as supplier selection. We'll touch on a little bit around the regulatory compliance side, accreditation, the importance, some things just around business, whether it be around financial stability, business continuity, and otherwise, just to give you a little bit of an insight and maybe a little bit of a snippet as you think about your selection process moving forward. So I think, Bonnie, you get to start us off. Maybe you can kick off just around the regulatory compliance area.
Yeah, so probably the most important criteria, as Lillian mentioned, is you need to make sure that the lab you select is an accredited lab. So is it an ISO 17025 accredited lab? And what does that mean? These are international standards, right, that are created to make sure that the data it's quality data, and not only that, but that the data can be accepted by other countries. Without any further testing. So this is a really big, major requirement. And then in addition to ISO 17025, you have other certifications and accreditations to look out for. So if you're doing in vitro toxicology testing, you want a lab that's using good laboratory practices, following the OECD test guidance documents to generate that data. In addition to accreditation, you also want to make sure the lab has a quality management system, a QMS system. And this is basically a set of processes, policies, procedures that just make sure that the lab can operate competently and generate data that's reliable and accurate, right, for your product. In addition, there's a variety of other things a QMS system looks at, right? And you want to have policies in place and procedures that protect client confidentiality, product IP. You want to make sure that the methods the lab is operating are validated, right? These are ICH, the International Council on Harmonization, You want to make sure the lab participates in proficiency testing programs. I think we have another slide to highlight, but just high level, these are the large organizations like Caresta that have developed, the tobacco testing methods that are used. So you want to make sure that the lab is using the right methods and they're validated for your product. Sorry, you can go right back. A couple more things, just basic things where you don't even think about it, but is there a sample isolation space that will avoid cross-contamination? If you don't have a menthol product, you don't want other menthol products being stored near it. And it's just a checks and balance system that ensures the data is accurate. And again, other expertise that you should look for in a lab is to make sure that not only do they have validated methods, but are those methods validated to your matrix, right, to your product? We know everyone in this room has a variety of different products. And then does the lab, as mentioned earlier, have one of these tobacco product master files, a TPMF, and in the TPMF will contain all the method summaries and the validation reports. And so if this is already on file with the FDA, all you need is a letter of authorization to reference it. And it will save you getting a deficiency letter from FDA, just headaches, right? So you want to make sure and ask, if the methods that are going to be used are in the TPMF. And I mentioned earlier, you want to make sure the lab is participating in organizations that just drive good science. They're participating in ISO, in Caresta, and that they have experience with PMTA testing, right? It can't just be any lab that says that they can run, nicotine testing, but that they actually have the experience and, have they generated data that has been successful with marketing granted orders. It's important. And experience with multiple stakeholders. So not only are they doing testing for companies, but does FDA, reach out and ask them to do testing for them? Because that's huge, right? If FDA is asking one of these testing labs to do specific analysis of products. And just that they're staying up to date with the latest methods, right? That you're using the best methods you possibly can use for your tobacco products. So a little bit more on experience and offerings. So even though in the PMTA final rule it lists the analytes, for instance, for HPHCs, harmful and potentially harmful constituents, you do have a list of analytes that FDA says you need to measure, but they also have this statement in there that in addition, other constituents as appropriate for your particular product. So depending upon your product, you may need to have analytes added. And so you would want to work with the lab that has the ability to develop methods and validate those methods for the additional constituents that you need. And then there's other, great things to have that maybe aren't necessarily a regulatory requirement, but does the lab, can the lab customize how your data is delivered to you in these electronic data delivery filables? So this will make your life a lot easier if you can customize it and then you can extract out the data you need for your statistical analysis, comparison for your PMTAs. And then in terms of complex statistical evaluation, this is just pretty simple around every method has an amount of uncertainty. And so you want to make sure the lab isn't going to be just doing one rep testing, right? But they're pushing back or they're giving you at least the concerns with doing one rep testing. And maybe you don't need to go and do 7 reps like FDA is telling you, but there's a balance based upon your product specifications. So it's just a dialogue to have with the lab.
Expanding a little bit on some of the comments that Bonnie's made. So as you're thinking about your vendor criteria, certainly what we've seen over the number of years as the PMTA process is initiated is the length and complexity of a lot of this testing, but also just the breadth and depth of testing that's required. So can you work with a partner that has a larger breadth of offering in order to actually simplify the process for yourself? Just a simple thing is data management and managing data across the network is one thing to think about, or just capacity planning. Much of these programs and projects can be long in nature. Certainly, you're not unseen. You might see things 1 week, 2 weeks, months in testing, but actually, sometimes testing can actually require, there might be lengths of quarterly or even semi-annually or annually, depending on the actual tests and requirements are necessary based on the actual steps in the process you are in your PMTA. So working with an organization that has capacity and scalability is critical as you think about your decision making. But ultimately, at the end of the day, what you're really trying to ensure is that you're trying to work with a group of organizations that are really experts and have credibility in the particular space that you're working in. One that we've certainly seen over the last number of years, and obviously the pandemic was a bit of a reminder and perhaps an accelerator, is the importance around business continuity. Now, we work with a number of very big organizations, global organizations. Obviously, this is front and center to the things that they're doing on a day-to-day basis. But we continue to bring this up as an area of concern that organizations around the world should be thinking about as they're thinking about their vendor community. Between the environmental, cybersecurity issues, financial issues that you're going to face, making sure that your vendor actually has a well-documented, robust business continuity plan that's not just in principle, but actually is on paper and actually is something that you can actually see how it would work in order to operate in times of challenge. Ultimately, as the actual supplier is your partner, you want to make sure that their limitations are not going to limit your production. And then strategic testing and planning. Bonnie, probably some things just to add here for your...
Yeah, definitely. So you really want to select a lab that you can have a conversation, right? So this should be a partner. Whether you have a consulting company work with you or if you're working with a lab, you need to be able to have conversations and have the lab make recommendations in terms of if you have a relatively new product but you haven't done enough testing, you don't want to launch in and do full PMTA testing and spend millions of dollars when then you realize, oh, I've got too many high levels of metal or I've got a problem here. So you want to do some initial pilot testing to make sure your product you're going to have good data come back from a PMTA. So these are conversations around, okay, so how do I be strategic? What type of testing? We know that it's a highly uncertain time right now, and so there's hesitancy for companies to do a lot of these testing or why even bother to do a PMTA? But if you show that you're basically doing the right thing and you're trying to come up with a testing plan, and maybe you're submitting multiple amendments and you're doing what you think is the critical testing and submitting that because you want to be able to check all the boxes, right, and not have FDA reject your application. So generate enough science, but rather than going off and trying to test all of your products as cheaply as possible and perhaps selecting the wrong lab, you be strategic, you pick the right lab, you do the best science, maybe on less products, and you submit that.
Ultimately, at the end of the day, what you're really trying to do is, are you partnering and building up your level of experts outside of your organization to really support your long-term journey? When you're thinking about this particular process, managing risk with clearly cost and the goal and the opportunity that you have ahead is a real big key criteria as you think about your actual strategic partners. And we're winding down in time here, but we're also asked to touch a little bit on, in the event of having to change a supplier, what that might look like. What we've put together here is just a bit of a roadmap decision tree that actually could help you make those particular decisions should you find yourself in a difficult situation. Ultimately, we look in our business every day and we see probably 15 to 20% of new clients coming in based on the fact that they've had to change a supplier for whatever reason. And those reasons vary depending on the actual situation at hand. Ultimately, as you're thinking about managing cost, certainly change, and at the end of the day, what you're trying to do is making sure that you don't repeat the same mistake. You want to make sure you go through a rigorous due diligence process to make sure that that new vendor is actually going to be the vendor of choice for the long run. Knowing that, I think Lillian talked to it earlier, this type of process can be awfully long. We're not talking days or months, you're often talking years. So being attached at the hip with the right strategic partner is critical for the longevity. Anything to add before we just conclude, Bonnie, on this topic or any of the preceding topic?
It's just basically, if you don't remember anything else, just remember you should ask questions from the lab who you're going to select to do your testing.
Okay, as we just wrap up here, any closing thoughts, Bonnie?
I just, don't be hesitant to ask, right? Mike and I are going to be here. I think Mike's here a couple of days here until Friday morning, but very approachable. Come and ask us a question. We're not going to collect your emails and then bombard you with sales emails to try to get your business. Just, yeah.
Bottom line, I think we just conclude is ultimately we are actually working on the same thing. We are trying to actually work in the industry and have a similar outcome goal that we're looking to achieve. So we appreciate the time today. We wish you a great TPE, and thanks for spending some time with us this morning.